Jeff Klauk and Dr. Selim Benbadis, thank you very much for joining me.
Thank you for having us.
Thank you.
Okay, Dr. Benbadis, can you talk to me about precisely what epilepsy is?
Epilepsy is a group of conditions defined by recurrent seizures. So patients who have more than one seizure are diagnosed with epilepsy. And seizures are abnormal behaviors related to an abnormal electrical discharge in the brain. These can be very mild, brief staring, mild abnormal movements, or they can be very severe with a whole body convulsions and fall and loss of consciousness for a couple of minutes. When a patient has more than one of those and they tend to recur, that is epilepsy.
And I understand there are different types of seizures. Could you briefly touch on that?
So in general, there are seizures that are what we call generalized, which means they arise from the entire brain at once, and those that are partial or focal that come from a small area of the brain. And even more importantly, the causes of epilepsy are very diverse. Some of them might be genetic or hereditary. Many of them are caused by a brain injury of some sort, either traumatic, a stroke, an infection, and all of those can leave a piece of scar tissue that can cause the seizures. And over half of the epilepsies that we treat, we don't know the exact cause.
Thank you for that information. Jeff, if you could talk to me about what it was like when you were first diagnosed with epilepsy.
Yes, it was late 2010 when I was had my first complex partial seizure, and kept having a few. And then in 2011, went to a doctor, and I was diagnosed with epilepsy. And my wife and I were determined to make sure we get the best care that we did, and that's what ourpledge.com is all about. Is being determined to go out there and get the best care you can, because that's the only way you're gonna, get to where you want to go.
Absolutely. Now, talk to me about how epilepsy affects your everyday life, and if I might, your everyday life is mentally and physically challenging as you play golf as a
Sure.
professional.
Yes, it definitely affects my everyday life, but I have to take medicine in the morning and at night, and my doctors and I have come up with a good medicines that we were taking and a good amount of dosage that's right for me, because all these medicines have different side effects, and a lot of them are blurred vision and dizziness. So obviously that doesn't go well with golf. So for me, I have to make sure I drink a lot in the morning and eat a lot of food, get some calories in me, and if I do that properly, I'll be okay for out on the golf course. So that's the thing that really helps me out a lot, and a lot of that is being open with my doctor, telling him how I feel, and the communication with your doctor is very, very important.
It sounds good, and now that you've got the regimen down, what you need to do, you are able to live a physically and mentally demanding life.
No question about it. Yeah, you try, and it's just being open with everybody, not being embarrassed to talk about it. And my life is just as good as anybody else, and except I have to take medicine. And I have a great support team around me, and that's one of the most important things for sure.
Can you talk to me more about the pledge? How did you get involved with it, and why did you decide to take it?
Yeah, the pledge is ourpledge.com is very, very important to take, with epilepsy, because, a lot of people just settle for being, feeling okay. And to me, that's not all right. There's so many things out there that can help you out, whether it's the surgery nowadays or so many different types of medicine. So speaking with my doctor, like I said, getting on the right medication for me has made a world of difference. And you take the pledge, and you can learn about epilepsy, and how to you communicate with your doctor is, like I said, very, very important. And just to better understand your condition, for sure.
Well, unfortunately, we're out of time. Where can my viewers go to get more information on the pledge?
Well, you can go to Epilepsy Foundation. They have some great information, and obviously go visit ourpledge.com and view the information we have there.
Great. Jeff Klauk and Dr. Selim Benbadis, thank you very much for your time. We certainly appreciate it.
Thank you.
Thank you.